Kaitlib Fe is a combination hormone medication used to prevent pregnancy. It contains two hormones, norethindrone and ethinyl estradiol. In each pack, there are 4 inactive pills taken during the 4th week that contain a small amount of iron, ferrous fumarate. These pills are meant to keep you in the habit of taking one pill each day, but they do not have enough iron to treat iron deficiency. Aside from preventing pregnancy, Kaitlib Fe may also make your periods more regular, decrease blood loss and painful periods, decrease your risk of ovarian cysts, and treat acne. It's important to note that using this medication does not protect you or your partner against sexually transmitted diseases. Before you start using Kaitlib Fe, make sure to read the patient information leaflet provided by your pharmacist. This will help you understand when to take the pills and what to do if you miss a dose. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once daily. Choose a time of day that is easy for you to remember, and take your pill at the same time each day. If you are taking the chewable pill, chew and swallow one pill every day. Some brands may also be swallowed whole. Some brands should be taken with water while others should be taken without water. Follow the manufacturer's directions for your brand. It is important to take this medication exactly as prescribed by your doctor. Follow the package instructions to find the first pill, start with the first pill in the pack, and take them in the correct order. Do not skip any doses. Taking this medication after your evening meal or at bedtime may help if you have any stomach upset or nausea. You may choose to take this medication at another time of day that is easier for you to remember. No matter what dosing schedule you use, it is very important that you take this medication at the same time each day, 24 hours apart. Your pill pack contains 24 pills with active medication and 4 reminder pills with iron. Take one active pill, with hormones, once daily for 24 days in a row. Take one inactive pill, with iron, once daily for 4 days in a row after you have taken the last active pill unless otherwise directed by your doctor. If you are taking certain medications that can interact with iron, ask your doctor whether you should throw away the reminder pills, iron pills, each day rather than taking them. If this is the first time you are using this medication and you are not switching from another form of hormonal birth control, take the first pill in the pack on the first Sunday following the beginning of your menstrual period or on the first day of your period. If your period begins on a Sunday, begin taking this medication on that day. For the first cycle of use only, use an additional form of non-hormonal birth control for the first 7 days to prevent pregnancy until the medication has enough time to work. If you start on the first day of your period, you do not need to use backup birth control the first week. Ask your doctor or pharmacist about how to switch from other forms of hormonal birth control to this product. If any information is unclear, consult the patient information leaflet or your doctor or pharmacist. Doctors may prescribe Kaitlib Fe to help with symptoms like nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles/feet, or weight change. It may also help with vaginal bleeding between periods or missed/irregular periods, especially during the first few months of use. If you notice any of these effects, let your doctor or pharmacist know. It's important to remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Some people using this medication do not have serious side effects. Kaitlib Fe may raise your blood pressure, so it's important to check your blood pressure regularly and tell your doctor if the results are high. Serious side effects can include lumps in the breast, mental/mood changes, severe stomach/abdominal pain, unusual changes in vaginal bleeding, dark urine, yellowing eyes/skin, and more. In rare cases, Kaitlib Fe may cause serious, sometimes fatal, problems from blood clots, so it's important to seek medical help right away if you experience symptoms like chest/jaw/left arm pain, sudden dizziness/fainting, or vision problems/changes. If you have any serious allergic reactions, such as rash, swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so contact your doctor or pharmacist if you notice any other effects. Remember to consult with your doctor or pharmacist if you have any concerns or questions about taking Kaitlib Fe. If you are over 35 years old and smoke cigarettes or use tobacco, do not take Kaitlib Fe. Smoking while using this medication can increase your risk of stroke, heart attack, blood clots, and high blood pressure. The risk of these serious problems increases with age and the number of cigarettes you smoke. It's important to keep Kaitlib Fe out of reach of children, as accidental overdose of iron-containing products is a leading cause of fatal poisoning in children under 6 years old. If an overdose does occur, seek medical help immediately or call a poison control center. Before taking Kaitlib Fe, make sure to inform your doctor or pharmacist about any allergies you may have to ethinyl estradiol, norethindrone, ferrous fumarate, or any other estrogens, progestins, or iron products. It's important to discuss your medical history with your doctor, especially if you have a history of blood clots, high blood pressure, cancer, high cholesterol, diabetes, heart problems, kidney or liver disease, obesity, stroke, thyroid problems, or if you have had jaundice during pregnancy or while using hormonal birth control. If you have diabetes, this medication may affect your blood sugar levels, so be sure to monitor it regularly. Let your doctor know if you will be having surgery or if you will be confined to a bed for a long time, as these conditions can increase the risk of blood clots. Kaitlib Fe may also cause skin discoloration, so it's important to limit your time in the sun and use sunscreen. If you wear contact lenses, you may experience vision problems, so contact your eye doctor if needed. It's also important to discuss the effects of this medication on pregnancy, breastfeeding, and fertility with your doctor. It's important to be aware of potential drug interactions with Kaitlib Fe. Always keep a list of all the products you use and share it with your doctor and pharmacist. Some products that may interact with Kaitlib Fe include aromatase inhibitors, fezolinetant, ospemifene, tamoxifen, tizanidine, and certain combination products used to treat chronic hepatitis C. Additionally, some drugs may cause hormonal birth control to work less effectively, potentially leading to pregnancy. Examples of such drugs include griseofulvin, modafinil, rifamycins, ritonavir, St. John's wort, drugs used to treat seizures, and HIV drugs. If you start any new drug, be sure to inform your doctor and discuss if you should use additional reliable birth control. It's also important to tell your doctor if you experience any new spotting or breakthrough bleeding, as these may be signs that your birth control is not working well. Lastly, Kaitlib Fe may interfere with certain lab tests, so make sure lab personnel and all your doctors are aware that you are taking this medication. If someone has taken too much Kaitlib Fe and has serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. You can call 911 or a poison control center for assistance. Symptoms of an overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. As with any medication, it's important not to share Kaitlib Fe with others. It's also important to attend regular physical exams and medical tests, such as blood pressure checks and pap smears, while taking this medication. Your doctor will also provide instructions on how to examine your breasts and what to do if you notice any lumps. Keeping all medical and lab appointments is crucial. If you have any concerns or need more information, be sure to consult your doctor. If you miss a dose of Kaitlib Fe, refer to the product package information for advice on what to do. It is important to use backup birth control, such as condoms or spermicide, to prevent pregnancy if you miss a dose. If you have any questions, it's best to ask your doctor or pharmacist for guidance. If you find that you often forget to take your pills as directed, it may be a good idea to talk to your doctor about switching to another form of birth control. This can help ensure that you are protected against pregnancy. Remember to take Kaitlib Fe at the same time every day for maximum effectiveness. Remember to store Kaitlib Fe at room temperature, away from light and moisture. Keep it out of the bathroom and out of reach of children and pets. Do not flush this medication down the toilet or pour it into a drain unless instructed to do so. When it is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.